Hello guys, if you have clicked on this video, you are one of the following three groups of people. Either you are somebody who has completely decided to not go the NEET PG route, or you are somebody who has given the exam and has just been frustrated with the uncertainty this exam just comes with, or you are somebody who wants to give NEET PG but just wants a backup or something to go along with it while preparing. Either way, I have made the video in such a way that I'll also talk about it, but also this video caters to all three groups of people. Now, after MBBS, a lot of us are made to believe that NEET PG is the only option that there is. But the truth is that NEET PG is not the only option. It is just the only option that we talk about. Properly, अच्छे से हमें कोई options बताता ही नहीं है. So today I'm going to talk about all the options that are there after NEET PG. I'll not talk too highly about them or too lowly about them. I'll just say the exact reality and I'll be honest about it. And I'll also say which ones you can pursue while preparing for NEET PG and which ones you can pursue independently, and also the struggles to get that job or also the cost and the earning wise. So to make the video simple, I have divided it into few broad categories. Some of them I'll be talking essay, some of them I'll explain via slides because they might be getting a little confusing. So let's get started, guys. So the first one that I'm going to talk about are the clinical jobs, and this is probably the one everyone knows about, but I'm going to talk about them a little depth mein. They can be government jobs and they can be like the private jobs. So if you're talking about the government jobs can be the medical officer, GDMO jobs, the ones which are like junior residency, house staffship. So if you are talking about the house staffship, etc., these are the ones which you can do up to 3-4 years after you have passed out your MBBS. As for the GDMO ones or the medical officer or the PHC mein jo hota hai, RMO, etc., for those you have to give separate exams through the government portals. And the best part about these are that in a lot of states, including my states, I'm from West Bengal, if you do 3 years of rural duty, not urban, rural duty, you are eligible for in-service quota in NEET PG, which is amazing because almost 30% of the NEET PG seats are for in-service candidates. Can you realize? 30%. This is one thing. Apart from that, the GDMO jobs, the PHC RMO jobs, they are good with respect to the fact that you have very fixed duty hours. You are going to get a lot of respect. And most of these jobs, they are in a little peripheral areas, little rural areas, and there they have a lot of faith in the government doctors. So you can also build your private patient base while you are practicing there. So if you are completely not going the NEET PG route, this is something you can consider. Now private, maybe there are ward duties. In private, the pay varies. If you are just passing out on MBBS, your pay will be a certain amount per hour. If you are going after junior residency, certain pay per hour. If you are going after 5 years of experience, your pay will vary. Usually in tier 1, tier 2 cities, it starts from 300 and can go up to 500 per hour. But also it varies about what skills you have. So if you're an intern watching it, please make sure you know some skills like doing a central line, intubation, etc. Because if you know these skills, your pay will increase. Now, among these, if you are going for a house staffship or in private, there are these ICU duties, etc. You can do duties for 24 to 48 hours per week, and then you can easily prepare for your NEET PG. Another clinical job that I want to talk about is UPSC CMS, but the most important part about UPSC CMS is it's a beautiful job with respect to the fact that you have very fixed duty hours. You are going to get a lot of respect, but it's also a very, very difficult exam. UPSC CMS examination ka difficulty is almost as the same or rather even more difficult than NEET PG exam. So you have to do a lot of preparation for it, and then you also have to prepare yourself for the interview round. So if you can clear it, there another very nice thing is if you are allotted, if you give NEET PG and UPSC CMS in the same year and your allotment comes before the CMS result, you can even take a leave and join your duty and then join back. Apart from that, if you actually do 5 years of UPSC CMS, get a posting and you do 5 years of that posting, you are eligible for in-service quota in the INI CET exam, which is great, right? Because you are having 5 years, 6 years of experience here a lot of savings here, because the exam also, the posts also pay very well. And then you are going to INICT. Most of the central institutes are very prestigious and without any bond. So either way, that is a very good option if you give the hard work for it and clear it. So this is all for clinical jobs. Of course, most of the clinical jobs that I talked about, they don't have the glamour, and the earning potential is fixed if you're just pursuing that job. But then you can start earning immediately. You also can grow your patient base, as I said, and also there is relatively less competition in this line, and it's a very stable. So after MBBS, a very common confusion that we have is between DNB Diploma, and Fellowship Certificate. But of course, guys, these are in no way the same. So I have put all three of them side by side so that you can yourself see and compare. I'm still gonna say separately about all three of them. Zyada detail mein chahiye to bolna. I'll talk about that even in broader detail. So first, if I come to DNB, जो broad specialty होता है, that has the same scope as MDMS. So of course you are going to require a NEET PG degree. Uske baad whatever, you are a full specialist after a DNB, and uske baad whatever scope you have after an MD and MS of that degree, you have the same scope. You can give the same super specialty exams. आपको प्राइवेट में सेम स्कोप मिलेगा. इट्स प्रेफर्ड द सेम एज एन MD and MS degree nowadays, so that is not an issue. Now coming to DNB Diploma, the biggest confusion is between DNB and DNB Diploma. Mind you guys, DNB Diploma 100% requires NEET PG, but it is in case you want to have a lesser training time. The training here is also hands-on. Everything is hands-on here also, but a very important thing is you do not have the same scope here as that of DNB. The ceiling is not the same, the opportunities are not the same, but it's also a recognized postgraduate degree in our cities. For example, in tier 1, tier 2 cities, you might have a problem, but DNB Diploma is pretty much preferred in a lot of tier 3, tier 4 cities, but you cannot give the same MCH exams, same degrees you cannot sit for. Next is lastly, but both DNB and DNB Diploma 100% require NEET PG, so it's not a NEET PG free route. Now coming to fellowships or certificates. Fellowships and certificates are not a postgraduate degree. It's a skill-based training. अगर आप already कहीं पे practice suppose कर रहे हो, or you just want an addition to your degrees, this is a very good option. But mind you, fellowships can be done in a lot of subjects, but it is not preferred the same as that of a degree, right? For example, if you are having a fellowship or a certificate in cardiology, of course someone with a DM cardiology will be preferred over you, because a lot of these fellowships and certificates are also obtained online and has a lesser training degree. But this is great if you just want to build your confidence, or you also already have a very nice patient base and you just want a job or a skill upgrade. Mind you guys, this does not require NEET PG. So if you are going to go for a NEET PG free route, or you want to practice want to start practicing immediately after MBBS, this is great. This also looks very nice beside your degrees, so this is a route you can definitely go for. Now guys, I will want to talk about something which is a very hot topic. A lot of us have considered this, a lot of us will be considering this, and that is going abroad. There are a lot of countries that have that accept Indian MBBS, and these are the primary ones. For example, UK जो होता है, UK में it's the fastest process, बहुत organized होता है, and I'm talking about directly after MBBS. You can sit for PLAB, it's not that difficult. But you have to pass the English जो proficiency होता है उसका exam जो IELTS होता है. So it is not that difficult. So passing, because most of us give our exams in English, give our vivas in English. So I have not separately mentioned it, but वो भी देना होता है. The process is the fastest. Pay अच्छा है. Cost wise, it is pretty reasonable. So as a result of this, right now in the UK, there is a lot of competition. So that is there, but it is the fastest. USA जो होता है, USMLE, has the highest scope, as in
if you are looking for very nice pay, if you are looking for the best work-life balance, it is USMLE. But the biggest problem here is before your residency matches, there is USMLE 1, 2, 3, there are a lot of steps, right? So you have to stay there for some time. As a result of this, the expenses are very, very, very high. So a lot of people, they do not opt for this because of the expenses. But if you are somebody who can provide for that expenses somehow, this is a very, very good option. Australia mein, if you are thinking of entering the system, it usually starts from supervised practice. Now, a very important country is Germany. It's a very, very good country to be settled in. But the biggest problem in Germany is the language. It is B2 C1 that I have mentioned. This is their proficiency level, the proficiency level that they expect from us, anybody who is outside from Germany, is B2 C1, which means that जैसे मैं आपके साथ हिंदी में बात कर रही हूँ, that is probably B2 C1. Like they expect the proficiency level to be very, very high, which makes a lot of sense because you're dealing with patients, right? So of course you have to be somebody who is pretty fluent in the language. And there जो entrance exam होता है, जो licensing exam होता है there, वो आप अगर लैंग्वेज का एग्जाम आप मतलब पार कर पाते हो तभी आप दे सकते हो. So the language is a place, if you are pretty proficient, if you are somebody who has learned German, then it's great. But this language part is a reason a lot of people fall behind. Middle East में the problem is that Middle East mein there are a lot of exams, but most of these exams, when they prefer people with a good work experience, so they are mostly service oriented jobs and not really trainings. So if they prefer work experience, so it is not the best after MBBS, because MBBS mein you do not have a lot of work experience na. So Canada, New Zealand is possible, but as I said, it's very, very competitive. So that is not something most people consider. But mind you, the most important thing that I want to mention here is that none of these are exam-free routes. In all of these, you have to give another exam. All of these countries have their own licensing pathway. It's either one licensing exam or licensing exams rather. Uske baad you can start practicing. But of course, the work-life balance is better outside. The pay is better. Most countries are richer than India. So yeah, that way also the pay is better. But you have to be very specific while choosing that. So I have attached, also I have not specifically mentioned about Asia countries, like Asia ka jo countries hai, like Singapore, etc. Because there na बहुत ही language barriers भी बहुत ज़्यादा है. They most of them, they do not understand English in a lot of countries. Okay, so the language barriers are very high and they do not prefer people who are not local. So बहुत ही limited recognition है in a lot of countries. For example, Singapore, I'm giving an example. MBBS is not recognized. Indian MBBS is not recognized. MBBS from very specific colleges of India recognized होते हैं. So this is a broad video, so I have not spoken about कौन से colleges, but बहुत ही limited recognition है. They are not mainstream routes, so I have not spoken about Singapore and Asia much. I have specifically attached all these countries का छोटा छोटा करके. If you want to take screenshots, आप screenshots ले सकते हैं if this is something you are considering.
Now guys, I'm going to talk about a group of offbeat options which a lot of people are pursuing nowadays, and there's also a lot of money here. The first one being medical research. You will see so many medical research jobs in LinkedIn. There is Indeed, and also ICMR regularly gives notifications for medical research jobs. There are a lot of doctors in government and private hospitals looking for people who will aid them in their research. And also there are a lot of companies who want doctors in their research team because it gives the research a lot of credibility. You will, and that if you want to pursue that, these are very stable jobs, the earning potential is good, and of course there's a lot of respect. After that, I'll talk about medical writing. But medical writing, I'll say the pay is not that great independently for someone who is starting in their 20s. So it's something you can do independently if you're good at it. Of course, the sky is the limit. But it can also be something you can be doing while pursuing your studies. For example, Marrow, PrepLadder, and all of these apps, they are also people who are actively hiring all the time for young students, young doctors to make their content because their minds are fresh. So you can keep in a lookout for these jobs, because these jobs you can do from the comfort of your home. You can study, and while preparing the content also you can study.
Okay, now we are going to talk about Bachelor in Public Health and Masters in Public Health. As you can see, the Bachelor's in Public Health is literally a bachelor ka degree. I have just mentioned it just to tell you guys the difference between the two. So bachelor in public health is an undergraduate degree, so it is not something people do after MBBS. बहुत limited value है. It's something people can do after their 12th. But masters in public health is a postgraduate degree. No NEET PG is required, but this masters of public health is very good because government के जो positions होते हैं वहाँ पे you have a lot of scope in the government. अगर आप हेल्थ एडमिनिस्ट्रेशन एक्सेट्रा में आप गवर्नमेंट में कुछ जॉब करना चाहते हो तो दिस MPH इट कैरीज अ लॉट ऑफ वैल्यू. So this is a postgraduate degree. Of course, no NEET PG required. So this is something you can consider. The competition is very less now because it's not that much recognized. But proper government जो एकदम confirmed jobs होते हैं policies में, research में, administration में, in those you can apply with this Masters of Public Health. It's a 2-year degree and बहुत ज़्यादा respect है. It's a very less talked about course, but this is something a lot of people should consider. Next is this. Nowadays a lot of people talk about MBA. So there's also something called Masters in Hospital Administration. If you see a lot of IIMs, etc., they are also providing good 6-month programs, 1-year programs in Masters in Hospital Administration. Of course, you can do MBA as well, but MBA में it's mostly in the pharma जो companies होते हैं, pharma companies, startups, because a lot of startups are there ना, health startups आज बहुत they are all around. So pharma companies, startups, administration में MBA has a lot of role. But masters in health administration, if there's a hospital, think of a hospital. We have all worked in hospitals, right? कितना कुछ manage करना होता है. So hospital management में a masters in hospital administration is a very, very, very evolving course, because if you are somebody who's a doctor, you will be able to manage a hospital way better than someone with just an MBA degree. So Masters in Hospital Administration, a lot of colleges are providing that. I can provide you a list of that if you want, and with the pay. So this is something a lot of people are considering. And also MBA, because pharma companies, they are wanting doctors. They are wanting doctors to increase their credibility. They are wanting doctors because the doctors will be able to apply their knowledge to for the growth of the company. MPs, so guys, I have said. Even ICMR has a lot of jobs जहाँ पे they are wanting doctors who have done MPH degrees. Okay, guys. So I've also said the focus. The main thing you have to note here is none of them have clinical work. So if you are somebody who has no intention of dealing with patients, they want to be in the administration, they want a proper stable life, these 3 are great options to consider. तो इस पूरे वीडियो को अगर मैं एक लाइन में सम अप करूं तो यही बोलूंगी कि नीट पीजी बस एक ऑप्शन है और वो अकेला ऑप्शन नहीं है. रादर if you want to do NEET PG after your MBBS, you can substitute a lot of these options with your NEET PG degree, which will give you even better career opportunities. Without NEET PG, all these options are very, very valid routes. They all have their separate level of mehnat, separate level of struggle, and separate level of payout. That said, you don't have to immediately decide कि आपको क्या करना है. अच्छे से वीडियो देखो, अच्छे से रिसर्च करो, सोचो आपको क्या चाहिए. And now that you have the clarity, take the decision accordingly, taking time. If this video helped you, if you want even more on a certain topic, or you're having difficulty in something, tell me. I'll make a separate video, broader way में about that topic. And if this clarity helped you, like कर देना and subscribe रहना, because we will have similar discussion on a lot of such topics. That said, Happy New Year. अच्छे से रहना, खुश रहना, साथ रहना. All the best, guys. Thank you.